Hello, my name is Dan Coit. I've been honored with the privilege of presenting to you my long-standing friend and mentor, Sir Murray Brennan, as an icon in American surgery. Lest there be any doubt, he's the one on the left. As anyone acquainted with him knows, Sir Murray is more than an icon in American surgery. He is truly an icon in the global community of surgical oncology, as attested to by his innumerable national and international honors, culminating in his award being named as Grand Knight Companion of the New Zealand Order of Merit. Murray Frederick Brennan was born on April 2nd, 1940, in a family home in Royal Oak, a small suburb of Auckland on the North Island of New Zealand, the only child of his parents, Joseph Frederick and Sylvia. Throughout his education, initially at Onehunga Elementary School, then subsequently at Otago University in Dunedin on the South Island of New Zealand, he was an accomplished scholar athlete, playing rugby union for Otago. His leadership qualities were recognized early on, as he was elected president of the Otago University Student Association. It was in that capacity that he met a visiting professor, Dr. Francis Moore, a meeting that would profoundly change the trajectory of his life. But let's hear about it in his own words.
So I started out thinking I would be an engineer. And it was only after that first year that I thought, no, this wasn't for me, that I decided to go to medical school. I didn't have a goal. I didn't think, I want to be a professor at some university. I never thought that, but I knew there's more to life than what I'm doing now. I actually still think that. There's more to life than what I'm doing now. But that's a good thing, because you're always dissatisfied with the status quo. Because if you sit with the status quo, nothing changes, The other gifts about being born in New Zealand is you're born in a very small society, and maybe that was one of the driving factors that I knew I would leave. So looking back, that relatively isolationist component was probably a healthy thing. You knew you got a great education, you knew you could handle yourself physically and mentally, and it made it easier to embrace other societies. Probably the most influential event in characterizing where I ended up was that I did not get a Rhodes Scholarship. Had that happened, I would have gone to the UK. I would have been at Oxford, and I probably never would have come back. I could have been small town surgeon in East Stepney Green, I've no idea. Francis Moore, who was then the Moseley professor at the Brigham, came as a visiting professor. And I'm the single guy, so I get to shuttle the professor around. And lo and behold, he gets on the plane, and he writes me a longhand note saying that, in a polite sort of way, well, there really aren't any medical schools outside Route 128, but you should come and work with him. But then, of course, he offered me a position in the residency, which, again, changed my life. I met remarkable people in the residency. Not so much the staff, but the people you work with remained lifelong friends. So that was a huge thing. I'd become remarkably good friends with Steve Rosenberg. We were both in the same vintage, and we'd both taken about 11 years to get through the residency. The difference was that he had a full 4 or 5 year PhD. I just repeated a bunch of things. And he was asked to take over at the NCI. And he said, you should come. And I said, well, I don't know anything about immunology or any of that. No, do the metabolism, endocrine stuff that you know about. And that, again, was a great decision for me. But it was more about, can I do it on my own? Could I put together a lab program? Could I develop myself as a person who predominantly was more interested in studying man as an experiment? You also had to learn to operate, because you didn't have a fellow to help you or an attending to help you. And we were doing very complicated endocrine, all of it reoperative surgery, mainly for endocrine tumors, recurrent hyperparathyroidism. We had familial kindreds of MEN. So I was able to bring that minor balance to this extraordinarily strong immunology program that Steve was building. And to work with him was a joy. I mean, completely supportive, constructively critical. It was a good time, and there were good people there then.
In 1981, Dr. Brennan was recruited from the NCI to become the chief of the gastric and mixed tumor service at Memorial Sloan Kettering Cancer Center.
When I came here to New York, it was the chief of a division, a service. I could have my own laboratory. I could have my own grants. All day Monday was devoted to the lab. Tuesday to operating, Wednesday to education and administration, Thursday to operating, Friday for the clinic, wrote grants on the weekends. Well, when I first arrived at Memorial, it amazed me that this very apparently affluent upscale place had very inadequate, what we might call record keeping. And I learned it the hard way. I wanted to write a grant, and so I went to ask them about, how many medullary cancers they'd seen, and they didn't use that diagnosis. So I realized I had to do it myself. I wanted to know who came on the surgical service. Now, all of those databases were initially surgically based. There were two reasons for that. One of them, the cynical reason, was I controlled them. But the more realistic one was, if you had a database that's surgically based, then you guaranteed you had not only control of the patient and their data, but their tissue. And we were, I think, prescient in realizing sooner or later that tissue would become important. So we began to bank tissue along with the clinical data, not really understanding what it would look like now with molecular analysis, but wondering that if we knew what happened to these patients, and some of them would do well and we didn't expect it, we could go back and say what was unique about that initial tumor. Databases should go forward, but they have to change. What we were collecting initially was natural history. It was pathology related. They're now identifying molecular markers and looking for targets, and a lot different. So categorically, the future is prospectively collected databases with tissue, and now more importantly, germline tissue, because the environment in which we were characterizing the tumor is now so increasingly sophisticated, we need to begin to characterize what's in the human genome.
In 1985, Dr. Brennan became chairman of the Department of Surgery at Memorial Sloan Kettering Cancer Center.
Many people have heard me say you take jobs for one of two reasons. You either want them or you don't want someone else to have them. As it turned out, the best job in America, in my opinion, was the job I took. And it was a different time. Chairmen of surgery were reasonably powerful in an institution. They were the source of a lot of the revenue. They usually had the best fellows, the best residents. It was a wonderful time. And then I was able to hire people who I thought would make a difference, hire people that were a little different, but a little willing to take a chance, to challenge people, to be part of the environment where, to question almost everything politely was what made a difference. I wanted to hire uniformly people that were smarter than me. I didn't want to tell them that. I wanted to hire them, and they could find it out subsequently to be too late. We had people running divisions, and it was a collegial department, who had already been chairs elsewhere. And so they were much like myself. They wanted to be where things were happening. They wanted to be the best neurosurgeon in the nation, the best colorectal surgeon in the nation. Now that's a gift. And then, of course, the fellowship, which is probably the best thing that ever happened to me, in the sense of these incredibly bright, smart, young, personally attractive people who we were able to bring as fellows. We didn't look for people that were going to all be the same, but we looked at people who could work together, preferably not be the same. The ability to even minimally influence those young people is a gift, and it's so rewarding to watch them. Many are now in leadership positions around the nation, which is great. And many are not because they don't want to do it. That's good too.
In 2006, Dr. Brennan retired as chairman of the Department of Surgery at Memorial Sloan Kettering Cancer Center.
I'd always said that I would stop being chairman at 65. And I put that in writing. But then, and I got to 66 while they found someone else. But then, of course, I had 5 wonderful years of being a real clinician, not having to worry about anything. I was no longer working in the lab. I was still working with all the databases I'd created. And then in those 5 years, I had 2 or 3 of the best young people to work with me that I've had seen in a long time. But I could fully commit to their growth. And that was a gift again. It was harder to stop operating than it was to stop being chairman. But I'd had this open rule about you have to stop operating 2 years before I tell you to, because if I have to tell you to stop operating, you can't work here anymore. But then I got to where I thought, wow, I'm 2 years away from when I should quit, and so I should stop. And I like to think I stopped when I was still pretty good in some ways. It was playing by my own rules that made me stop, hopefully at the top of the hill. So when I stopped being chairman, I was asked if I'd be interested in taking over some of our international programs. And I said, yes, but I need 2 or 3 years to develop that. I'd been fortunate in that I had reasonable exposure around the world, so that wasn't too difficult. And that's morphed into development of several great things, I think. It wasn't just about the international triage of people who wanted to come. It was about the international surgical fellowships. It was about helping develop a gastric cancer diversity program, a global disparities program led by Peter Kingham, fantastic person to do that. Here we have this global disparities cancer initiative predominantly focused in Nigeria, predominantly in West Africa, some in East Africa, where you're really trying to help change the whole societal component.
Over the course of your career, you've had multiple academic contributions, achievements, and awards.
My CV is not me, but it's packed full of committees, and I mean, I must have served on every committee of the American College of Surgeons in one form or another, including leading several of them. But again, I didn't seek that. It educated me. I enjoyed doing it. It was a huge commitment. I don't think people quite understand the enormous commitment that people put to those who sit on the American Board of Surgery. The time commitment, the commitment to societal progress by the American College, by the American Board of Surgery. And then the little more erudite contributions of things like the American Surgical. Yes, that's been time consuming. I've been very pleased to take leadership roles in those. I didn't go looking for them, which is good. I would encourage them, but not with urgency. These things are going to happen to them anyway. I would encourage them that first 10 years out of fellowship, put together your life, put together your practice if that's what turns you on, put together your clinical investigation, begin your educational leadership role. The rest will all come. One thing that's important, which I hope is evident, is I try very hard not to take myself too seriously. I try very hard not to think that whatever rewards, accolades I got are for me. They're built on other people. I'd like to say that most of the international honors I got were not because I was the leader of a particular organization. They were recognition, first of all, that I'd contributed to that organization, usually in the people we'd trained, and I'd had a presence. The knighthood, obviously, is extraordinarily rewarding. The actual award that I got is one of the highest ones you can get in that thing. But it's also been very rarely given to people who did predominantly all of their contributions outside the country. And I don't believe it's ever been given to a cancer researcher. I don't believe it's ever been given to a surgeon. So it's important that it recognized that you could do work that influenced the country. Well, a lot of what I've done has been hard work. A lot of what I've done has been pretty well organized in terms of control of my time. The accidents that come along, of course, They're not really accidents, they're opportunities. And I've been fortunate that I've been in the right place at the right time. It's all about growth, I think. You know, we euphemistically talk to the fellows, you know, our job is not to turn you into the complete package. Our job is to provide you, the fellows, with the tools to grow, and then challenge them to identify what are the tools for you to grow, not for me to grow, for you to grow. There's been a lot of, I feel much more like I'm running along a little mountain chain than I am trying to get to the top of Everest, which I was never wanted to do. I never aspired to climb the highest mountain, but I did want to climb a lot of mountains. So I would argue that the great gift I was given is that there were a lot of significant small mountains.
Do you have any advice or final message for surgeons yet unborn?
Well, thinking about the people that certainly don't know me and will never know me, what is it that I would say to them 20, 30 years later? I hope this is true. I hope they will still believe what an extraordinary privilege it is to look after another human being. My wife was a physician, and we set out with totally unrealistic expectations of 2 professional careers, which would now probably be possible, but was not possible then, although we didn't appreciate that. So yes, my family's paid a pretty high price for what I've done. I think they've turned out remarkably well. I'm so fortunate that I have this wonderful relationship with most of my adult children. I mean, I think that's a gift that I may not have deserved, but I'm more than willing to take it. Yeah. The good news is I feel physically well, but I'm still trying to decide what I want to do when I grow up. Is there something else? Well, I'd like to finish what I'm doing, but I won't. I'd certainly like to put in place some of these international programs where they're completely self-sustaining. That's important, both for the institution and for me and the people behind me. If you have a legacy, it's going to be the people you influence. It's the people that come behind you that in some way you've made better people. In some way you've made them better surgeons, but better clinicians, better, more thoughtful people, perhaps kinder people, perhaps more tolerant people. So if you have a legacy, if I have a legacy, then I'd like it to be some influence on the people I've been fortunate enough to help educate, not educate, help educate. That's a legacy.